if you're one of the millions suffering from sciatic nerve pain right now, I understand exactly what you're going through. That shooting pain radiating from your lower back down through your leg can be completely debilitating. Today, I'm going to share 5 simple yet incredibly effective exercises that can provide almost instant relief for your sciatica symptoms. These exercises take just 60 seconds each to perform, but the relief they offer can last for hours or even days. Stay with me to the end because I'll also share some crucial tips that most physical therapists won't tell you about preventing sciatica flare-ups in the first place. Before we dive into these game-changing exercises, let's quickly understand what we're dealing with. Sciatica isn't actually a condition itself, but rather a symptom of an underlying issue. The sciatic nerve is the longest and widest nerve in your body, running from your lower back through your hips and buttocks and down each leg. When this nerve gets compressed or irritated, it triggers that characteristic pain that can range from mild discomfort to absolute agony. Common causes include herniated discs, bone spurs, spinal stenosis, or piriformis syndrome, when a small muscle in your buttocks irritates the sciatic nerve. What makes sciatica particularly frustrating is how it can affect every aspect of your life. Simple activities like sitting at your desk, driving your car, or even just trying to get a good night's sleep become painful challenges. According to recent statistics, up to 40% of people will experience sciatica at some point in their lives, with those between 30 and 50 years old most commonly affected. The economic impact is staggering too, with billions lost annually to work absences and healthcare costs. Many people immediately reach for pain medication when sciatica strikes, but there's growing evidence that targeted exercises can be just as effective, if not more so, for providing both immediate and long-term relief. A 2018 study published in the Journal of Orthopedic and Sports Physical Therapy found that specific stretches and movements can reduce sciatic pain by up to 70% when performed consistently. That's exactly what we're focusing on today. Now, before we get into the exercises, I want to emphasize that consistency is key. While these movements can provide instant relief, incorporating them into your daily routine will yield the best long-term results. Also, remember to move gently and never push through sharp pain. Discomfort is normal, but pain is your body's warning signal. Let's start with our first exercise, the knee to chest stretch. This gentle stretch helps to create space between your vertebrae, reducing pressure on the sciatic nerve. Begin by lying flat on your back on a comfortable but firm surface. A yoga mat on the floor is ideal. Keep your knees bent and your feet flat on the floor. Now, slowly bring your right knee toward your chest, clasping your hands either behind your thigh or just below your kneecap, whichever feels more comfortable for you. Hold your knee gently against your chest for 20 to 30 seconds, making sure to breathe deeply throughout the stretch. You should feel a gentle pulling sensation in your lower back and possibly in your glutes. The key here is to keep your lower back pressed into the floor. Don't allow it to arch. This ensures the stretch targets the right muscles and doesn't put additional stress on your spine. After holding for 30 seconds, slowly return to the starting position and repeat with your left leg. What's happening physiologically during this stretch is fascinating. As you pull your knee toward your chest, you're creating decompression in your lumbar spine, which can relieve pressure on the nerve roots that form the sciatic nerve. Additionally, this movement helps to stretch the piriformis and other gluteal muscles that can become tight and compress the sciatic nerve. Some patients report feeling an immediate release when performing this stretch correctly. For those with more severe sciatica, you might want to modify this by only bringing the knee as far as is comfortable. If you have acute disc issues, consult with your healthcare provider before attempting this stretch, as certain disc herniations might be aggravated by flexion movements. Moving on to our second exercise, the piriformis stretch. The piriformis muscle is a small muscle located deep in your buttock. When this muscle becomes tight or inflamed, it can irritate the sciatic nerve, which often runs directly beneath or even through this muscle in many people. This stretch specifically targets this muscle to provide relief. Start by lying on your back again, with your knees bent and feet flat on the floor. Cross your right ankle over your left knee, creating a figure 4 shape with your legs. Reach through the triangle formed by your legs and grasp behind your left thigh. Gently pull your left thigh toward your chest, keeping your right ankle crossed over. You should feel a stretch in your right buttock. Hold this position for 30 seconds, breathing deeply, then switch sides. What makes this stretch particularly effective is how directly it targets the piriformis muscle. In approximately 17% of the population, the sciatic nerve actually pierces through the piriformis muscle rather than running beneath it, making these individuals particularly susceptible to piriformis syndrome. Even in those with the more common anatomy, a tight piriformis can press against the sciatic nerve, causing symptoms identical to other forms of sciatica. A clinical tip from physical therapists: if you feel more pain when performing this stretch on one side compared to the other, that's often an indication that the piriformis on the painful side is contributing to your sciatica. Pay special attention to that side in your stretching routine, but don't neglect the other side entirely. For those who find this position difficult, a modified version can be performed seated in a chair. Simply cross one ankle over the opposite knee and lean forward slightly from your hips until you feel the stretch in your buttock. Our third exercise is the seated spinal twist, which helps to mobilize your spine and stretch multiple muscles that can contribute to sciatic pain. Begin by sitting on the floor with your legs extended straight in front of you. Bend your right knee and place your right foot on the outside of your left knee. Place your right hand on the floor behind you for support. Now, hook your left elbow on the outside of your right knee and gently twist your torso to the right. Look over your right shoulder and hold this twisted position for 20 to 30 seconds, focusing on lengthening your spine upward with each inhale and twisting slightly deeper with each exhale. After holding, slowly return to center and repeat on the opposite side. The seated spinal twist offers multiple benefits for sciatica sufferers. First, it helps to improve mobility in your spine, particularly in the areas when nerve roots exit your spinal column. It stretches your piriformis and other external hip rotators that can compress the sciatic nerve. The gentle rotation can help realign your spine and pelvis, potentially taking pressure off nerve roots that may be compressed due to misalignment. A study published in the International Journal of Yoga Therapy found that rotational stretches like this one improved symptoms in 79% of participants with sciatica after just 4 weeks of regular practice. The researchers attributed this to both the mechanical effects of the stretch and the relaxation response triggered by the controlled breathing that accompanies it. For those with more severe symptoms or limited mobility, you can modify this stretch by performing it while seated in a chair. Simply cross one leg over the other and twist toward the side of the crossed leg, using the chair's backrest to help you deepen the stretch safely. Our fourth exercise is the standing hamstring stretch. Tight hamstrings can contribute significantly to sciatic pain by increasing tension on your lower back. This stretch helps to lengthen these powerful muscles on the back of your thighs. To perform this stretch, find a stable surface like a chair, step, or low table that's approximately knee height. Place your right heel on this surface with your legs straight but not locked. Keep your back straight and hinge forward from your hips, not your waist, until you feel a stretch in the back of your thigh. Hold for 30 seconds, breathing deeply, then switch to the other leg. What's crucial here is maintaining proper form. Many people round their backs when performing this stretch, which can actually increase pressure on the spinal discs and potentially worsen sciatica. Instead, focus on keeping a straight back and hinging from your hips. Imagine your hips as a door hinge. They should be the point from which you fold forward. The hamstring muscles attached to your sitting bones, ischial tuberosities, which are part of your pelvis. When these muscles are tight, they can pull on your pelvis, tilting it in a way that flattens the natural curve of your lower back. This altered posture increases pressure on your spinal discs and can exacerbate sciatic symptoms. By regularly stretching your hamstrings, you help restore proper pelvic alignment and reduce this pressure. For those who find this stretch too intense initially, try a modified version by placing your heel on a lower surface or even keeping your foot on the ground and simply hinging forward slightly. You can gradually work up to the full version as your flexibility improves. Our fifth and final exercise is the cat-cow stretch, which is excellent for improving spinal mobility and relieving tension in the entire back. Begin on your hands and knees in a tabletop position. Your hands should be directly under your shoulders and your